Hello everyone, I'm Dr. Brandon Drabek, a naturopathic doctor, and I want to thank you for joining me today. I'm excited, really excited to have this opportunity again to connect with you all. I had a lot of fun doing the Facebook Live yesterday. It was very well received, and I thought that I should continue providing Facebook Live drops like this, and will continue to do so on my page regularly in the future. I'm way better at doing video than I am typing blogs or vlogs that nobody really ever reads anyway. So thanks so much for joining me. I'm really, again, excited to have this opportunity, and I just want to share with you a little bit about how naturopathic medicine, how it can help kickstart your health journey. Whether you're new to this approach or you've been exploring natural healing for a while, I hope you find something useful, from some of the insights today. So before I dive in, let me tell you a little bit about myself. As a naturopathic doctor, my primary focus is helping people achieve optimal health by addressing root causes of illness and improving their physiology or function, if you will, rather than just managing their symptoms. My goal is to work with each of you in a holistic way, using natural treatments and therapies that are personalized to meet your needs. So what is naturopathic medicine? I get that a lot. I know before I became a naturopathic doctor, a client of mine had said, I think you'd make a great naturopathic doctor. And I thought, what the heck is that? I've heard of osteopaths, medical doctors, chiropractors, never heard of a naturopathic doctor. And of course, I looked into it, and it really aligned with where I was at in my career at that time as a holistic health practitioner. I was primarily doing physical manipulations and body work in a wellness center. And I thought, yeah, this really aligns with who I am and where I want to go with my career. So what I want to answer today is, again, that primary question is, what is naturopathic medicine? Why is it effective? And I want to start off with that there are 6 core principles that guide everything we do as naturopathic doctors. The first core principle, which we take extremely seriously, is first, do no harm. Naturopathic medicine focuses on gentle, non-invasive therapies that support the body's natural healing processes, and we aim to minimize harm and encourage healing from within. We actually follow a therapeutic approach, and I'll share with that maybe I'll share that in a future video. But I have a poster here in my office. It's called the Therapeutic Order. And there are 5 primary key things that we do in that therapeutic order. The first thing is remove obstacles to health and establish the foundation for optimal healing. So that's foundational stuff, right? Drinking water, eating good food, getting sleep, managing our stress, etc. The next step is, of course, stimulating self-healing. We, as naturopaths, inherently believe that the human body can heal itself. The next step from there, support and restore weakened systems. One of the key things, as I said before, we don't really manage symptoms. We don't treat symptoms. We treat systems. We treat the whole person. It's a holistic approach, mind, body, and spirit. We help correct structural integrity. There are some naturopathic doctors that do manipulation similar to chiropractic. Others don't. I do provide manipulation for my patients, but not the same way as a chiropractor. As I like to call it, that rack 'em, crack 'em, pop 'em, sock 'em kind of care. I like to provide what we call neuromuscular manipulation or Bowen therapy. And because I was also trained in a system called polarity therapy, I like to bring some of that information in as well. And lastly, natural substances to restore and regenerate. And I'll talk a little bit more about that here in a moment. The last 2 tiers on the top of this pyramid on my poster say pharmacological substances used to halt pathology and high force interventions, also known as surgery. Well, naturopathic doctors do not, and I emphasize that, treat with drugs, medications, or surgery. That is well outside of our scope of practice. This is not an affront to naturopathic medical doctors. or naturopathic physicians, if you will, who have such training, but regardless, at the end of the day, it is not part of naturopathic medicine. And so those last two steps, those last two tiers on our therapeutic order are given to the realm of pathologists or pathology, medical doctors. That is their wheelhouse. That's where their understanding is disease and pathology. So again, the first order is do no harm. The second is to treat the whole person. So this is actually the cornerstone of naturopathy. We consider the physical, emotional, and mental health of the individual. Everything is interconnected, and by addressing the root causes of your symptoms, we can actually help create a balance in your life. Third is to identify and treat the cause. So instead of trying to mask symptoms, we dig deeper to understand the underlying causes of your health issues, whether it's an imbalance in your hormones, digestive system, or even your stress levels. Addressing the cause actually helps create lasting change. It improves your medical outcomes. So the goal isn't to, like 30, 40 years ago, it was kind of this mentality that it was an us or them sort of idea where, either you do all medical care or not at all. You do all alternative medicine, as they called it back then, or none at all. You didn't do both. And I'm a big proponent of incorporating healthcare from all sides. Healthcare is a continuum. Wherever you choose to enter, it's kind of like a carousel. It's always moving, going in a circle. You just got to hop on somewhere and take a seat. And then we can get you connected with the right people. So making sure that we have all players. This is a team effort to help you improve your health. I know I can't do it all, and I definitely rely on the physicians that I refer to, chiropractic physicians, medical physicians, primary care medical specialists, even, when things need to be addressed, even on that level. 4 is the healing power of nature. And our bodies have, again, an amazing ability to heal. And nature provides us with an array of powerful tools. Really, there's no legal definition as to what natural medicine is. And so having done this for a little over 15 years now, I've come to the understanding that people are looking for food as medicine, as Hippocrates supposedly stated. They're also looking for botanicals or herbal medicines and remedies to help support their health. So we use herbs, we use nutrition, and lifestyle changes. I was just reading recently, I'm currently taking a course in personal training so I can understand exercise better. And it said in that course that about 80% of chronic disease simply comes from poor lifestyle choices and physical inactivity. So that support with herbs, nutrition, and lifestyle, it helps enhance the overall process. Number 5 is prevention is key. It is always better to prevent illness than treat it after it happens. I honestly prefer seeing healthy patients who don't have any issues, but just simply want a wellness checkup and have an understanding of where they're at, so that if there are any things that need supported, we can work on that to prevent anything from occurring down the road, or at least, again, improving their overall outcomes all around. And so prevention is key. And of course, by emphasizing healthy habits and lifestyle changes and protective measures, it helps keep those people, it keeps you thriving. And lastly, doctor as teacher. Doctor, the Latin root is docere. It means teacher. When we meet for the first time during an initial appointment, that whole appointment is learning about you. It's listening to your story. And once I get to, review all of your intake forms and review lab work and things, then my turn comes after that follow-up appointment where I get to educate, teach you about your body and how the blood work markers, for example, are relating to how your symptoms, or how you're feeling rather, and how we can use food and these natural tools to help you work through those. So doctor as teacher, I'm here to guide you. I'm here to empower you with knowledge that you need to make informed decisions about your health. That's key, informed decisions. Together, we'll work, of course, to achieve your goals and obviously maintain long-term health. So I just want to share a quick success story of one of my patients who had made really incredible progress by bringing a naturopathic approach into her life. She came to me struggling with chronic fatigue, digestive issues, mood imbalances, and we did a thorough evaluation. I did a full health risk assessment, physical assessment with her, looked at her, ordered some labs, looked at her blood work, just a very thorough evaluation. And one of the things that we do, with that evaluation, in addition to that physical assessment, we get your blood work back, but then what you do is you get this functional health report. This is one for a patient that I'm meeting today, and it's, 50 pages long, and it tells you all about, your markers, what they mean, and how, how they connect to one another and relate to various organs, glands, and systems, and, when they're out of balance, how to bring them back into balance. So after this, really thorough evaluation, we discovered several underlying causes, primarily gut imbalances. That was a huge issue for her. GI inflammation. And so by working through that, we were able to help her. Also several nutritional deficiencies. Particularly, I remember B12. She was, having lots of low energy, and B12 was one. Obviously, some vitamin C and a few others, and adrenal stress. Our adrenals are sensitive to our environment, internal and external. So we worked together. We created a plan together, which included bringing food into her life with key nutrients that would help support those systems. We did use, as I said, naturopathic doctors, we're drugless doctors, so we no medications, right, in our world. I'm not against it when it's needed, of course, but targeted supplementation was key. And I'm not talking about the supplements you can get off the shelf at like CVS, Walmart, Rite Aid. That's a completely different level. We're talking nutraceuticals, patented, research, trademarked ingredients, with herbal ingredients as well, and that's a whole nother level than what you get at the drugstore. And then, of course, we made some lifestyle adjustments to help her manage her stress. I recommended. I typically, with clients, I'll recommend techniques that I've learned from positive psychology, cognitive behavioral therapy, dialectic behavioral therapy, and meditation, in addition to my favorite, which is essential oils for emotional support. And just within a few months, she reported obviously feeling way more energized. Her digestive symptoms had improved significantly. She felt much more in control of her mood. And it was really amazing to see how much of a difference that addressing some of those root causes can really take. So now I would really like to hear from you. If you have any questions about naturopathic medicine or anything that I do, or how naturopathic medicine or I may be able to help you in your health journey, I want you to drop those questions in the comments. And I'm actually going to be in the next video, so next week, I will be answering those questions. And so don't hesitate to ask anything that's on your mind. And if you're, of course, ready to take the next step and get some personalized guidance, I invite you to book a discovery call with me. You can go right to my website, brandondrabeknd.com, and select the Book Now button. And the first option is a discovery call. It's free, 30 minutes if you need it. It's there. It's a complete free discovery call. And it's just getting to learn a little bit more, answering questions you might have, and again, how I can help. But I'm going to be addressing I'll be addressing your questions in the next video. So again, whether you're dealing with chronic conditions, looking to optimize your wellness, or you just need a roadmap to improve your overall health, I'd love to work with you. So thank you so much for tuning into this video. I'm looking forward to connecting with all of you soon, and take care. And remember that your health journey can begin today. Bye.